Thank you, Charmaine, for the introduction. I'm really pleased to be able to speak tonight, and I'd really like to congratulate you and the Thoroughbred Breeders for putting this on, and an amazing number of participants. So well done, and thank you very much. So I've been correcting limb deviations for many years, and some of me say not so well in my earlier days, but certainly we've made a huge step forward in the last 10 years, I think it's fair to say. And I'm really horrified to show you this image on the left. This is what we used to do 10 or 15 years ago, 20 years ago maybe. And we would mess around with shoes way too long, and we'd contract feet and we'd do strips, and we'd end up with something like this. And I think you've done this horse a real disservice. Thankfully, with some fantastic improvements in surgical techniques and also the use of some really nice composite and shoes for feet, we end up now expecting a result like this. And from a function point of view for the horse on the racetrack, it's so much better. From a sale perspective, it's so much better. And I think from all our, as a veterinarian, the pleasure in getting this is so much better as well. Look, I'm assuming the audience is pretty well experienced, and I think they are. And so I really don't have the time or see the need to talk about the types of deviations, the ways we assess them, whether strips work or whether they don't. But I really wanted to concentrate on bridging and the use of implants to correct these deviations. What I thought I'd do tonight was present about 13 questions, or answers to about 13 questions that I commonly get posed or asked every year. And I thought that might be a nice way of doing it. So we're talking about bridges, where we place an implant, a metal implant, usually, on effectively the long side of the leg to stop the leg grow, to stop that site growing. So this is a fetlock joint. This is the growth plate just above the fetlock. This is the actual joint itself, and this is the growth plate below the fetlock joint. And here we've placed a single screw that goes across the growth plate, temporarily stops that side growing whilst ever that screw is in place, or until the whole thing is shut, whilst allowing this side to continue to grow. Right? This is the newer technique we've been using for the last 10 years or so. This is what we used to do. We used to put 2 screws, and we would avoid going anywhere near the physis or the growth plate, and we would put wire across it. Now, this technique would work, but we would commonly get a cosmetic blemish, and this was really not such a great result for a horse that was trying to be sold, essentially. So these are all types of bridges, right? The new fetlock technique, the old fetlock technique, this is what we commonly will use at the knee, where we've got 2 screws and wire, and I'm going to show you some other knee bridging techniques later. This is the technique that we first published out of Scone 10 years ago, where we used an absorbable screw, and we were hopeful that the screw could be put in, we wouldn't have to take it out, and it would absorb and go away. Unfortunately, it took a number of years for that screw to absorb, and so from a sale perspective for thoroughbred racehorses, it was not particularly useful, but certainly we still use this technique in warm bloods or Arabs, which are not destined for the sale ring, and I'm sure there's lots of other breeds, but we don't tend to see many of those. This is the technique that we use at the hock as well, single screw into the hock joint, or sorry, into the hock to cause a bridge. So first question is, how do I decide a fetlock needs bridging? We're going to divide the questions into fetlocks, knees, and hocks largely. Now, you may look at this foal as it's being born and suggest that it's going to need a fetlock bridge straight away because of the deviations you can see down here at the fetlock joint. Well, it's amazingly hard to predict sometimes what will happen to these foals. Some foals will be born with very obvious deviations and they will come good with relatively simple treatment. Others will get worse as they get older, having been born quite well. So I think what's important, if you've got a persistent deviation at 8 weeks of age, then you need to start thinking about whether you should be undertaking some more aggressive type of corrective surgery, such as a bridge. Now, I think what's happened in the last 10 years, we've all learned that we've got this technique of bridging available to us, and we've become much less aggressive in relation to confinement and farriery and doing strips, because there is no doubt what's very important for a horse's development is for it to be a horse and to be in a normal paddock, right? So if we can try and say, look, we know we've got a deviation of the fetlock, it's relatively severe, but if we can try and treat it like a normal horse, put it in a paddock, not lock it up, not confine it, not really mess with its normal development, then I think the end product is so much better for the person that breeds it and sells it and the person that races it or uses it for some other endeavour when that horse retires. So 8 weeks is the time you really need to think about it. We know that at the fetlock joint, there is growth potential somewhere between 4 to 6 months of age, right? Some horses will shut their growth plates at 4 months of the fetlocks, some of them at 6 months. But we know at 8 weeks, there's still quite a lot of genetic potential. So there's still a lot of growth potential. One of the things that has a great effect on whether a foal will have a deviation that improves or doesn't improve is genetics. Genetics is a bigger factor, and I think we won't go into any more detail on that, but it's very important to look at this to determine who the stallion is and also look at the mare, because often the foal will look like mum. We also know that foals that are heavier tend to have more severe deviations, and it is harder to correct that deviation. So that works against us. And we know that foals that have offset knee conformation or varus or bowed knee conformation, it is harder for those fetlocks to self-correct. So it's important to look at that. And then, of course, you need to consider the cost. You need to consider the risks associated with procedures. And you need to consider what is the desired outcome. Now, we all know that plenty of warm bloods can compete very happily with toe-in conformation. And we know that many standardbreds are actually probably better slightly toe-in because they're less likely to interfere with each other. So we need to know what is the desired outcome for what you want. Should I place a hoof wall extension when I do a fetlock bridge? I think the answer to that is only to really try and maintain the shape of the foot. I think extensions are not, I think the way you think of an extension, it's not to resolve a deviation, but it's to try and maintain the normal shape of a horse's foot, because that is paramount to ongoing soundness. Now, this is a Darrick shoe, and these have got a place, right? These definitely have a place, but I think aggressive use of these cause constriction to foal's feet, and you can see here where we've got some cracks that go up into the coronary band. These are the more common types of extensions that we put on horses or foal's feet. Now, this is a glue-on extension. There are some really nice glue-on shoes that we have available to us as well. I think that the answer to the question is you do not necessarily need an extension when you put a bridge on. I don't think it's going to make the bridge work any better. I think it's there to try and maintain the shape of the horse's foot, then that's fine. This is slightly different for knees. If you've got a very severe knee deviation, then I do think that something on the foot can actually help the bridge work a little better. When will the bridge be ready for removal? It's the most common question I get posed to me, and it's really hard to answer because it's really variable. And the things that cause an effect is the severity of the deviation when the bridge is placed. The greater the severity, the more likely it's going to take to resolve. We know that foals, when they're born, pretty much have their fastest growth rate. And as they age, their growth rates will slow down, but they also will get variations in growth rate as they get older. They'll get growth spurts. And so if you place a bridge at a very young age, you can predict when it comes out a lot easier than if you place it at, say, 3 or 4 months of age, because you're hoping for a growth spurt. And so the age of surgery is important in relation to growth rates. We know that the hind legs tend to respond slower than front legs, and I think that relates largely to the fact that the severity of the deviation is greater in a hind leg when people decide to bridge them. The foal's weight is very important. The heavier the foals, the slower they are to improve. There's no doubt about that. If a foal has a physitis or a lump at the growth plate, which is usually on the opposite side to where the bridge is placed, then that does tend to slow growth in the foal's leg, and so they will take longer to improve as well. What is the desired outcome? What is the final result you want? There's no doubt most foals, if you have one leg with the worst deviation than the other, and most commonly the left or the near front is worse than the right front. And I'll show you this video in a minute. But so the desired outcome might be, look, I don't want 2 surgeries to take the screws out. And so I'm happy to have one leg that's got perfect conformation and one that just slightly toes in a little bit. What we're really trying to aim to do when we place bridges is we're trying to place the bridge at a time such that when the deviation has corrected, the growth plate is shut, and there's no chance that we can, if we miss it, we can overcorrect that foal, or there's no chance if the bridge comes out that the deviation may reoccur. And that's a really good way to try and measure that. And it doesn't always work, but we can certainly, having done a few now, we've got a better idea. This is a slow-mo video. This is a foal that's had a bridge done on the right front, and this is a really nice result in relation to the right front. But if you look at the left front, this foal is now wanting to toe in on the left front, and this becomes a lot more evident when you watch this foal in slow motion at the walk. And there's no doubt the use of iPhones is fantastic, especially in slow-mo. So I often do this in slow-mo. I'll look at it, and then I can play it back to the owner. Sometimes, you know, if they're not looking these up every day, finds it hard to really visualize that this foal has got a deviation in the left front, and we're probably ready to take the one out in the right, but now I'm going to say to you, gee whiz, I'm really sorry, but maybe we should be bridging the left one as well. What are the cosmetic results? And this is really important, there's no doubt. I think there's two main factors associated with what the cosmetic result outcome. One is how it's done, how the surgeon puts it in, and what sort of environment they place the screw in. And is it sterile, is it not, to some extent? The second is post-op care, and that is super important. We've certainly got some farms that we do that we are very confident that they'll get a cosmetic outcome, and others that the cosmetic outcome may be a bit more variable. And I think those two factors are really important. What should you expect? Okay, if I was to bridge a foal, what would I expect to see as a normal outcome? This is a foal that's had a bridge, and this is the lump that I would expect to see at about the time of removal. So the deviation in this foal is nice. If anything, maybe it's slightly overcorrected, maybe it's slightly valgus. We can see that this foal was probably deviated because it broke away this part of the foot, but also notice we've had nothing on this foal's foot, and we've actually got a really nice shape to this foal's foot. So that was what I would expect in 98% of my foals when they came back for bridge removal. The other 2% get problems with whatever, white hairs, with some lumps, potentially some infection, things like that. What would I expect at the sales? I would expect that lump to have resolved and gone away, but I would obviously have a very small skin scar that you might see. I would expect that there is no screw hole on the servo radiographs, right? Even as weanlings, they should have gone before they get presented to the weaning sales. Certainly as a yearling, you should not see a screw hole on yearling radiographs. Now, what is really important is the size of the screw that we place. If we put smaller screws, then there's much less chance that we're going to have a hole than if we put a larger screw. And we're going to talk about that in a minute. I'd also expect to see a normal foot like this. And not only should we see it from grossly and clinically as we look at the foal, but we shouldn't see changes on radiographs. Years ago, when we were really aggressive at stripping and putting extensions on and locking them up, I do think we more commonly saw changes in the pedal bones. And I think the fact that we've got this technique avoids that. Now, just quickly, we'll touch on the knee. Certainly if we bridge a knee, then we do see an increased risk of a blemish. And I'm going to explain to why that is in a minute. So when we started bridging a lot of foals, fetlocks, this was a burning question, right? What's the cosmetic outcome? What do we expect? Am I going to be able to sell it as a foal, as a yearling, sorry? Or am I going to show it? Or, you know, what do I expect? So we followed 400 of these cases to yearlings. And we identified that if there was no infection associated with either putting the screw in or taking the screw out, then they looked excellent. And you could barely tell they were done. If there was infection, then there was commonly some form of blemish. And that told us that it's really important to strive to reduce the infection rate. So, next point, can you do the bridges on the farm? And I understand why people want to do this. It avoids transport and the risks associated with that. It avoids taking a foal into a new environment, and I understand the risks associated with that. But there is no doubt there are significant risks associated with anaesthesia. And if we get infection, there is a significant risk of a blemish, plus there's risk of the fact that you might have to take that screw out if you can't resolve the infection, and you won't get the desired outcome. So no, we're not doing bridges on farm. Now, I'm not sure if some people are, but that's certainly our feeling, and we feel as though there's really good reasons that if you're going to go to this level and try and get a good outcome, then we're going to give you the best one we can. Anaesthesia, you know, I think when a horse comes in for anaesthesia, everyone just expects it's going to survive. And that's not always the case. There are significant improvements in anaesthesia techniques these days. Just giving gas for anaesthesia technique is somewhat old school now. And there's very advanced methods of anaesthesia when the risks associated with death or injury are now much, much lower if they're done in that way. And I think certainly if you're going to consider a compromise to how you do them, then I suppose you need to accept that there may be some high risks, and how do you manage that in relation to clients or insurers. The surgery, it really needs to be done in a sterile technique. It needs to be done in the theatre. It needs to be done with appropriate placement, and we will always x-ray these foals. And having done many, every now and again I will x-ray them and go, oh yeah, I'd like a slightly longer screw to make sure that's going to work. Now, some may suggest that if you compromise a little bit on getting stuff done, then you can counter that with antibiotics. And I think these days with antibiotic stewardship, we're very mindful that we shouldn't be using antibiotics, and if we do, then we will create problems for ourselves down the track in relation to resistance. Our approach at Skye on Avon was that they may get one dose of antibiotics at the time of surgery, and that's all. Can you do the removal standing? And I get this too. There's no transport, there's no cost, there's no environment, there's no risk associated with anaesthesia. And I think the answer to that is, yeah, you can sometimes. Certainly for a knee, it's very achievable to take this type of screw out, which is a single screw, and we'll talk about them in a minute, to take them out standing, absolutely. In the fetlock, we use a 3.5mm screw because we found we get much better cosmetics. And there's no doubt the downside to that is these are much harder to get out standing. And in many situations, it's much less traumatic to try and remove these under general anaesthesia. Interestingly enough, we actually find a high rate of infection at screw removal, even under general anaesthesia, than we do when we put the screws in. And I think the reason for this is that people go, the process is over, we're done. The leg looks good, screws out, let's put it to the paddock, because we know how important it is to get them to the paddock. And I think sometimes the aftercare is just lost a little bit, and I get that too in the middle of the season. So yes, we can do them standing sometimes, but again, there's sometimes a compromise to this as well. This is a question I think is really important. How does it affect racing potential? And one of the questions that we're posing at this talk I'm giving in a few weeks is, are we bridging too many foals? Are we getting too aggressive? And I think my answer is very clearly no. Because we've got a great technique and it works really well. And we know from this paper that it really doesn't have an effect on their racing potential. So at the time when we're looking at what's the cosmetic result, we also wanted to know, how does it affect their racing potential? I was rather hoping our paper may say they actually have a better ability to race than their siblings, but unfortunately said they were as likely to race. So what we did was we looked at quite a number of foals in a short time period that went that we bridged at the fetlock with a single screw technique. And then we compared them to their brothers and sisters, their siblings. And we looked at their 2- and 3-year-old racing careers. The reasons we chose the siblings is it removes genetic influence. So if I was to compare the horses that we bridge at Scone to those that were bridged in the Northern Territory, you would rather hope that they'd do better in Scone. So we tried to remove that influence. And these were the results. We certainly, it was interesting that we bridged more fillies than colts, and I don't really know why that is. But certainly we identified that if we're going to bridge just one side, it's much more commonly that we do the left side than the right. And I suspect this is the genetic influence back to some horses at some period of time in the breeding cycle. What we identified was that there was no significance between the horses that were bridged and the horses that were not bridged at the age they first started, the number of starts they did, the number of wins, the number of placings. Colts were as likely to race as they were at 3 years of age. Fillies were as likely to race as a 2-year-old, but not as a 3-year-old. We couldn't quite work out why that was. This is a good number of cases, but maybe we need 1,000 to try and remove some bias as well. So we were confident that if we put these bridges in, they'll get a good result. The cosmetics is great, and they go to the racetrack and they perform very happily. So that's a really exciting process. Can I bridge the knee of a weanling or a yearling? And the answer to that is absolutely, but there are some other considerations you need to make. The growth plates of the knee stay open until about 16 months of age. So this is a knee joint here, and this is the top knee joint, the radiocarpal joint. This is the growth plate. And that physis or growth plate stays open to 16 months of age. And so we can manipulate that growth right up to that period of time. Now, when single screw at the fetlock techniques became popular, people started also putting them into the knee. And for good reason. The cosmetics was good, and it certainly would appear to work. This was the older technique, or now what we call probably the newer technique again, at the knee, in that we identified there were some problems with this technique, and we have converted somewhat to here. This is a yearling that has got it's relatively mild, a mild carpal varus deviation. I think this is probably a weanling. At a weanling age, this foal or this weanling should be slightly valvulus. Its leg should slightly come out to here, but it's starting to get bow-legged. And between now and Christmas is when you'll see these horses. They'll start doing really well in the spring, and they'll start to go bow-legged at the knee. And these are the ones you really need to consider for knee bridges, because doing anything else is largely a waste of time. Occasionally they will self-correct, and you've got a bit of time to allow that to occur. It's very common that you'll need to go in and do something surgically on these horses. So what's the racing prognosis for horses that have had knee bridges? And this is a paper that came out of the USA. Not as many cases as you'd probably like, but certainly a good number. And they did the same thing. They compared their performance to that of their maternal siblings. And they identified that the technique of bridging the carpus is useful up to this 16 months of age. And they identified that it didn't affect their price in the training. For training horses, which is a much more common way to sell horses in America than it is in Australia. And it really had no effect on whether they started, how many wins, whether they, and their earnings as 2- and 3-year-olds. So they identified it, again, it was a good technique, and they seemed to go on and race very successfully. I read on the last slide that it said up to 4.4% of horses had overcorrection. Please explain. And I think this is really relevant. So what's happened is this technique became very popular when we started bridging fetlocks, and we were using a single screw. And in the vast majority of cases, it goes very well. Occasionally, what's reported between 1% and 4%, and my experience, it's actually higher than this. When that screw is removed, there is a permanent bridge that forms at that site. And so even with screw removal, what should happen is both sides of that physis should grow at the same rate. If you get a permanent bridge here, that will stop growing and that side will continue to grow and the leg will become overcorrected. So we have gone back to using this technique much more commonly now because we know that this is going, the surgery is going nowhere near the growth plate, and we know that the chance of getting an overcorrection is significantly lower. I'm going to show you a video here on the right. This is a horse that had both knees bridged. And I'll just leave it on there for the minute. You can see this horse was bow-legged, right? And then what's happened is the screw was put in at about 10 months of age. It was taken out and it's overcorrected. It's now got this nasty valgus deviation. I'll play it again. The leg on the left is good, right? That's been a beautiful result. This is a disaster because we can't correct it, because now this horse is about 16 months of age and there's no growth potential left. So we've reconverted to doing this technique under about 13 months of age. And what we're trying to do is we're trying to time the implantation of these implants for when the growth plate is going to close. So the problem with this technique, all right, this is the single screw, this is the technique we can use, is you've got wires here and the cosmetic result is not as good. And that's certainly been our experience, that once you put more hardware in, you don't expect as good a cosmetic result. So sometimes the clients will consider, do I take the risk with this single screw expecting good cosmetic result, or do I do this technique knowing that the risk of overcorrection is virtually being removed, but I know that I'll probably get a worse cosmetic result. So we're a bit frustrated by that. So we've now just about to publish this paper actually, where we're using what's called fiber wire, which is it's a material, it's a very strong material. It's actually stronger than wire. And this horse has actually got a bridge in place, but because we've put this fiber wire, which is a fabric, you actually can't see the fiber wire that goes from here to here. We've demonstrated in this paper by taking x-rays before the surgery, at the end of surgery, that this technique works. This fiber wire is very strong, it's never broken, and now we've changed to using that material for knee bridges going forward. And we've now done about a dozen or so, and the cosmetics is great. We're much happier with the cosmetics with this technique compared to the older technique. So we feel as though that we've removed some of the complications that we've learned from our mistakes. Can I bridge a hock? The answer is yes. And there's no doubt the technique that we tend to use is this single screw technique. This is a young foal that's presented, not, it's banging its hocks together. We're not going to bridge these anytime soon because most of these improve themselves. We're certainly not going to strip this foal because I think it's an absolute waste of time. And we're not going to put shoes on this foal because I think that's a waste of time as well. So we're just going to sit tight. And we know that at around 6 to 8 months of age, if that deviation is still present, then we can put this screw in and expect a very good result. And that's sort of a nice time to bridge a horse too, because it's developed normally. You've left it in the paddock, you haven't done much with it. And at 6 months of age, it's probably going to be weaned, and mum doesn't have to sit in a box either. So this is a nice technique. We don't have to do this very commonly. We'd only do a few of these a year, but we know that if you do have a horse with a deviated hock, there is an option for treatment. What you must do is, more commonly you'll see a horse with a deviated hock is because it's got collapse of the tarsal bones here. Classic failure of ossification, they get a collapse of the tarsal bones, and the deviation will occur here. So if you look at this horse from behind and you follow lines down the bones, you'll see really the line crosses in this horse about here, and we know that's the growth plate, right? So there's a very good chance that this is due to a deviation of growth. If that line was to cross down in here, then I'd be more worried about a collapsed hock, and I'd strongly suggest you should get that horse radiographed. Can I bridge Can a bridge help offset knees? And the answer to that is yes, indirectly. Most horses with offset knees do have a tendency to become toe-in at the fetlock or bow-legged at the knee. Now, the issue with an offset knee is because there is actually an anatomical change in the shape of the knee, and it's not associated with a conformation. We cannot modify that, okay? We can only modify the growth plate above, but we can't modify the actual change in the shape of the knee. So we can't change the offset knee, but we can make sure that the fetlock doesn't become toe-in or the horse doesn't become bow-legged at the knee by putting a bridge potentially in the fetlock and the knee. So if you're looking at a foal with a toe-in fetlock and it's offset the knee, it needs to heighten your concerns about whether it needs some corrective surgery. We also know there's really good evidence that horses that have got carpal valgus that turn out from the knee, but not as bad as the one I showed you with the that's got the overcorrection, but certainly if there's slightly carpal valgus, it's actually protective for lameness associated with offset conformation. So when I'm looking at horses to purchase for buyers, I really don't like seeing horses that are bow-legged. I think it really increases their chance of having lameness problems. And there's no doubt if they're offset at the knee, then I think that also increases their chance of lameness problems when they hit the racetrack. Can I bridge to help outward rotation? And the answer is no. But let's look to the future. Hopefully some smart cookie will come up with a way to do this, but certainly at the moment we don't have that. If you know what I look like, I pretty much look like this one. And unfortunately I wasn't corrected as a kid. The future's good. This is my son who's 5, and at 54, I've still not caught a fish as big as he has. So let's hope the future's brighter for all of us. Charmaine, that's it for my talk. Be happy to answer some questions.
Thank you, Angus. That was a really informative talk there. Everything's been amazing tonight. I'll open the floor to some questions for Angus. We have one here. So from Ben, do you think extensions help with conformation early on prior to bridging?
Yes, I think they can, Ben. I think they can help. There's no doubt. I think what you're trying to do is you're trying to have that foot land where it should be when the horse is ambulating. And so, yes, I think they can help. There's no doubt. I think they can do harm too. And I think you need to be less aggressive about putting them on. And I think in the back of your mind, trying to maintain the shape of the foot. I'd much rather have a horse with a good foot that's slightly toe-in than a horse that's not particularly toe-in, but its foot's really deformed. So I think the answer is yes, with caution.
Perfect. I have Tani said, not a question, but that was a really great presentation. Thanks so much. Now, Newton Equine said...
I didn't pay Tony to say that, Charmaine, either, by the way.
Oh, didn't you? That's great, because I did have a few that I paid to make sure that you... No, I'm joking. Thanks, Angus. So regarding the use of fibre wire, are you experiencing any issues with the removal of the fibre wire once correction has occurred?
No, we're not. We were a little nervous that the body may create some fibrosis within the wire because the wire is a multi-filament and then it might be difficult to remove it, and that's not been our experience at all, no.
Peter's asked, approximately, what does a corrective procedure cost?
Yep. So if we're to put a screw into one fetlock and then take it out of one fetlock, it's somewhere in the vicinity of $2,500 to $3,000. If you do 2 fetlocks or 2 knees, it's more like 3.5, something like that.
Carly has said, what do you recommend treatment-wise post-surgery? For example, chondroprotective, such as Pentastin or Pentastin Gold. Great presentation, thank you.
All we recommend post-surgery is they get no antibiotics, they get no bute, they get no chondroprotectives. All they get is good, high-quality bandaging and a period of confinement. Now, I'm glad whoever asked this, because I've done something with my screen. I can't see who's asking the questions, but I think what it is important, and I touched on it, is not locking these foals up for long periods of time. So they need to be locked up long enough to reduce the risk of infection, but not too long enough that it really interferes with their natural skeletal development. So our preference is they are locked up for about a week, and then they are put out into paddocks at that point of time, providing it's not super wet and you're really worried about the bandage getting super wet. The issues we see post-operatively with complications are heightened when it gets hot. If they sweat under their bandages and the bandages are put on in such a way that they try and prevent water coming into the bandage and so they can't breathe, that's when we tend to see high rates of infection, high rates of white hair formation. Did I answer all that question, Charmaine? Sorry.
I think you did. Now we have Siobhan who said, have there been studies conducted of horses with deviated legs with no surgery and their performance and success on the racetrack?
No, not really. Who do you compare them to is the issue. So, I mean, I suppose we've done it the other way around, haven't we? You know, we've said they've had surgery and then we compare them to horses that haven't had surgery. And certainly when we compared them, we checked that those horses hadn't had surgery. So we're doing it the other way around. And I suppose if you had have come up with the results that if you bridged a horse and their chances of racing was so much less, then you would say, gee whiz, we're doing the wrong thing here. We're causing some other problems. And the horses that haven't had surgery are probably better off. So no, it's not been done directly. I suppose you extrapolate from the information that's presented. There's actually not a lot of information published in the veterinary literature on deviations. We've managed to publish a lot of it, but more needs, you know, it's like anything. We're always striving to get some more information.
I can imagine. Now, Kira said, although no significant race outcomes in those treated with bridges relative to their siblings, is there any statistical significance in race performance for a horse that has fetlock valgus or varus deformity relative to their peers?
No, we don't know that information either, honestly. We don't have statistical information to support that. We've got some information out there. Peter Huntington might be able to answer some of these questions better than me, but my anecdotal feeling is that horses that are slightly toe-in do very well, often on the racetrack, quite frankly. Horses that are outward rotated or severely bow-legged at the knee don't do so well. So I don't think there's any doubt that horses that have got a mild varus and sometimes even a moderate varus conformation can race, and they can be quite successful. I think what happens is we look at broodmares at 10 or 12 when we go, gee whiz, look at her legs. She's really quite badly toe-in. Isn't it amazing she raced? But I think what happens is horses' conformation, once they get to 6, 7, 8, 9, they automatically generally become more and more toe-in as they get older because the bone at the bottom of the cannon starts to remodel. So if you look at an older broodmare and you go, oh my God, she's really toe-in, and we know she was a Group 1 winner, well, I bet you she didn't look just like that when she was a 2- and 3-year-old when she was racing.
Okay. And we have a few more here. So what's the best type of thing to bandage with post-operative? So
we use, and I'm not endorsing products, but I'm sorry I don't know the name of the raw material in them. We tend to use a soft band type material, which is the material that does not absorb fluid and it tends to wick fluid away. So we'll put a soft band on them. We'll then put some sort of cotton wool or combine. And I think what's really important is then when a lot of us use these Coflex style of products, and again, I'm not endorsing products, and we use too much of them because those products stop breathing. They don't allow tissue to breathe under the bandage. So I think you need to be very careful with how much you use of those. But we will put some of that on, but a very thin layer, and then we will often just put elastoplast at the top and the bottom. We try and avoid really covering these limbs up. So soft band, not too much, not too restrictive to airflow, or at least allowing fluid to move away from the surgical site and preventing that leg from heating up too much. After a week or so, then we will often just go to a little 4x4 swab and some elastoplast around the leg, and that's often enough. Okay, and finally, Louise has asked,
or in my experience, previously there's been debate on box confinement versus small yard confinement post-surgery. What is your opinion on this if you remove the weather component?
Yeah, I think small yard's fine. Honestly, within a day or so, I think it's fine. You know, there's small yard and there's small yard. It's a relative term. And I mean, a lot of our farms don't have 1,000 small yards to use, and it can be a bit troubling to try and get horses in them. But yeah, I'm comfortable as long as it's not raining and there's not long grass to get these horses in a small yard. I'm forever trying to move horses out of boxes. I think that's a really important thing to do for these young animals.